Today we are going to take a look on the topic of cysts of orofacial region. So first let's take a look at what a cyst is. So cyst is a pathologic cavity within the hard or soft tissues that may contain fluid, semi-fluid, semi-solid or gas and not always lined by epithelium. So this is what basically a cyst is. So cyst is a cavity. So it is something like this. It's a cavity, and this cavity can be seen within a hard or soft tissue. So it can be seen inside bone maybe, or it can be seen inside a soft tissue, some kind of a soft tissue, and it may contain, sometimes it may contain some sort of fluid, or sometimes it is semi-fluid, sometimes it is semi-solid, or sometimes it may be filled with just gas. Okay, and it is not always lined by epithelium. Sometimes it may be lined by epithelium, sometimes it may not be. So yeah, this is kind of a pictorial representation. So what I'm trying to demonstrate here, this is a tooth with caries over here, and because of this caries, it's quite deep, and it has affected the periapical region, or there is some sort of a stimulation that has been initiated in the periapical region, which resulted in this cyst over here. So this can be a inflammatory cyst. Okay, now let's take a look at the fundamental classification of cyst. So cysts can be true cyst. So true cysts are those cysts which are lined by epithelium. There are also pseudocysts. Pseudocysts are those which are not lined by epithelium. We'll go deeper into the classification in the next video. So in this video we are more focusing on the pathogenesis. Let's dive into the pathogenesis of cyst. So for the pathogenesis of cyst, there are three requisites. There should be a source of epithelium. There should be a stimulus for the proliferation of the source of epithelium, and a capability for bone desorption and cystic growth. So these are the three requisites which is required for the pathogenesis of cyst. Now let's move to the phases of cyst formation. So there are actually three phases for cyst formation. First one is cyst initiation, and there's cyst formation and cyst enlargement. So these are the three phases of cyst formation. Now let's take a look at each one of them. First is cyst initiation. So during this stage, there should be a stimulus which is going to cause the formation or initiate the formation of a cyst. So in case of an inflammatory odontogenic cyst, infection is the stimulus. So in case of inflammatory odontogenic cyst, infection is the stimulus, and in others, the cyst can initiate from developing odontogenic epithelium. So the second phase in the pathogenesis of a cyst is cyst formation. So during this particular phase, the cyst cavity gets lined by stratified squamous epithelium. So now we know that cyst is a cavity somewhat like this, and during the cyst formation phase, what happens is that this cyst cavity gets lined by epithelium, and this is stratified squamous epithelium.
The next stage is cyst enlargement. In this stage, the cyst is formed and it starts to grow and enlarge irrespective of its type and its origin. The cyst is going to enlarge irrespective of its type and origin in this particular phase. Now, the enlargement of cystic lesions can be due to either increase in the volume of contents, increase in the surface area of the sac or epithelial proliferation, resorption of surrounding bone, or it can be rarely due to displacement of surrounding soft tissues.